Hi, and welcome to Manned Up Conversations, where we connect with evolving men to discuss issues around masculinity and manhood, and also provide tools to help us be better for our society.
You actually now reminded me, when I was talking about the whole thing in the bedroom, you reminded me, I was telling you earlier on about how the difference between males and male and females, and how erectile dysfunction is such a big, contentious issue that even in my students, remember I told you how I lecture students and whenever I have this thing that when they fall asleep, because our lectures do take on they carry on for quite a while, and I tell them beginning of the lecture that, listen, if any of you fall asleep, you have to crack a joke. And so one of the ladies fell asleep and she had to now tell a joke.
Okay.
And then she was like, do you guys know about a club that was started that was called Erectile Dysfunction? So all the guys were like, and then they were like, what? And then they said, no, well, the club was a complete flop and nobody came. And, and I'm talking about young students who are in their early mid-20s, but still erectile dysfunction is still like such it was, they laugh, but then at the background you could hear that there's a little bit of so the girls are making fun of our condition. So the one guy said, no, listen, you know what, I've got a joke. And by the way, he wasn't sleeping, but he just felt like, you know what, I've also got a throwback. And then he's like, what did the one saggy boob say to the other saggy boob? And that everybody's like, what? And he says, no, we better get support or else they'll think we're nuts.
So here we go. I think this is a very important day on Manned Up Conversations because not only are we talking about something very prevalent in the male community when it comes to men's health, but we've got our second lady, almost said first lady because it's been so long since we've had a woman on the podcast. So Dr. Morolo, welcome to Manned Up Conversations.
Oh, thank you very much. It's a pleasure for me to be in your company and in the company of your listeners and viewers.
Sure. No, I appreciate that. We want to talk about prostate cancer, and it's interesting that we brought a woman to talk about prostate cancer because a lot of us men feel like certain issues that we deal with only can be solved by men, or, when it comes to health especially, we only need to see a male specialist or male doctor. When it comes to mental health, maybe for depression and things like that, you need to see a male coach. But you're doing something very different. And I just want to know, in your experience, how has it been working with men with prostate cancer?
Working with men with prostate cancer is very interesting. It is true that most males in the beginning are a little bit uncomfortable when they see a female urologist, but once they've got to trust you, they open up, and the sex issue doesn't become an issue. But like I mentioned when we were having our pre-chat while you were setting up, I have had experiences where, for example, when I was training as a urologist, when I was still a registrar, which is the term we use for training urologists, when I was at the clinic, and at that stage, I was the only female registrar among the group of males. Wow. When I walked into a clinic and I walked into a room, the males would then see that, that in that room there's a female, doctor. And as such, when I'd go out and call the next guy, they would be like, no, it's fine, you go to the next guy. And then ultimately I just thought, you know what, I have to find a way around it. So I used to just go in silently in the back room and then tell the patient to call the next patient. And as such, then when they walked in, they'd be a little bit perturbed, but then, they'd be accepting. And so I just think that it's a perception that is easily challengeable. So patients initially go back to what they know and what they're exposed to.
Yes.
But then once they allow the new situation to pan out, they're happy with the service they get. And obviously majority of my patients are male, so majority of my patients are happy. But that doesn't mean to say that it was an easy journey from the beginning. So and I love working with males. males, actually, to be honest with you. I told you that most of my exposure has been males than females. So I'm more intimidated by females. When a female comes in, you know that their problem is more complex, you know, whereas with males, it's the more common and more conditions that you're exposed to on a day-to-day. Wow. So yeah, but I love treating patients. For me, male and female doesn't matter. So that has been my exposure.
Man, and I love that you're saying that, you know, it's common stuff that you're kind of used to when it comes to men. But there's also a story, or can I call it a belief, that's going around that men don't seek help, you know, for medical issues, especially. We wait until the very last minute to go see a specialist or a doctor or anyone who can help us, for that matter. So why do you think that's happening?
I just think that males traditionally have been portrayed as the strong, like timeless, like the epiphany, the symbol of strength and health. And so once you start presenting to a healthcare professional, it's almost like you are conceding that you have lost your strength or you've lost your health, and that health, I think traditionally health and strength has been associated with, strength has been associated with health. So I just think that males feel like when you're not healthy, you're almost like not man enough. And even if you're seeing things going wrong, for you to go to a healthcare professional and for them to confirm that there is something that can be called, or you know, that can be diagnosed based on what you're feeling, then it's a bit of a problem, you know, and that's what we need to challenge, because as we grow older, as we're exposed to environmental risks and hazards and toxins, things do go wrong in our body, and it is important to keep checking your body so that when they do go wrong, you can actually catch them while it's still early and then treat them. And more importantly, never mind catching them before, you know, while it's still early. Consulting a healthcare professional is also an opportunity to learn how to prevent other conditions, because sometimes what you hear in the street is not necessarily the truth. And so it's important to hear preventative measures that you can take before any disease sets in from a healthcare professional. So it doesn't mean that you only have to go when you've got problems. You can simply just go for a checkup, and if there's nothing, you basically can, you know, be told how to prevent other conditions, you know. Not all conditions are preventable, but certainly some are, and you can certainly get the opportunity to be guided and taught and get more information about things that are preventable, that you can, you know, learn for yourself and for people around you. Remember that because men don't consult healthcare professionals, I actually think that those that do consult have the responsibility to then share their knowledge with other men. Because I know that men have a lot of groups that they get together. Men socialize, I think, a lot more unstructured socialization. Women have a lot of get-togethers, like Women's Day and women's outings and all that. But men get together a whole lot more, you know, unstructured. Like they have a beer there and they have friends coming over here and there. And then those are the opportunities to use a little bit of time to just talk about men issues, health-wise, you know. And so if you're that person who consults a lot, don't take advantage of or lose the opportunity to share your information with other men casually. And I mean, health doesn't need to be a formal, like, uncomfortable discussion. It can be fun, you know, it can be an opportunity to learn more about yourself. It can be an opportunity to actually enhance who you are. For example, performance in the bedroom, you know, some people are holding a whole lot of baggage about maybe they're not performing as well as they used to in the past, in their 20s, 30s. Once you get into your 40s, things start changing a little bit, and it can wear a lot of burden on you. And if you can just chat to other men, maybe other men are open and they can tell you, hey, listen, I've got help, because there is help out there. And then you can actually, you know, explore other ways of bedroom fun, for example. I'm using that as an example, but I mean, you can learn a lot and actually realize that you can be better than who you are, and perhaps learn how to maintain your health if everything is still fine on your side health-wise. Yeah, so...
And I mean, that's why we're having this conversation as well, because we want to, I think a lot of guys would say, but KG, why are you talking about prostate cancer? Like, is there something wrong with you? I'm like, no, well, not right now, not that I've been for a checkup or anything, but I think it's worth putting out the information and speaking to professionals like you. And, a guy like myself, I'm going to learn a lot from this, and I might be able to pay it forward to someone who might be struggling, who might be needing some kind of advice,
Yeah.
So it is very important to have these conversations. So I encourage you, man, read up online, do what you need to do just to know. It doesn't mean that you're reading stuff or you're talking about stuff, there's something wrong with you. Right?
You actually now reminded me, when I was talking about the whole thing in the bedroom, you reminded me, I was telling you earlier on about how the difference between males and male and females, and how erectile dysfunction is such a big, contentious issue that even in my students, remember I told you how I lecture students, and whenever I have this thing that when they fall asleep, because our lectures do take on for, they carry on for quite a while, and I tell them beginning of the lecture that, listen, if any of you fall asleep, you have to crack a joke. And so one of the ladies fell asleep and she had to now tell a joke.
Okay.
And then she was like, do you guys know about a club that was started that was called Erectile Dysfunction? So all the guys were like, and then they were like, what? And then they said, no, well, the club was a complete flop and nobody came. And, and I'm talking about young students who are in their early mid-20s, but still erectile dysfunction is still like such a, it was, they laugh, but then at the background you could hear that there's a little bit of like, so the girls are making fun of our condition. So the one guy said, no, listen, you know what? I've got a joke. And by the way, he wasn't sleeping, but he just felt like, you know what? I've also got a throwback. And then he's like, what did the one saggy boob say to the other saggy boob? And that everybody's like, what? And he says, no, we better get support or else they'll think we're nuts. And so this is just like another demonstration how erectile dysfunction is like such a big thing.
Sure.
And funny enough, most patients who come with erectile dysfunction, some of them are brought by their partners. The wife says, listen, let's go and find out how we can improve our, situation in the bedroom. I know the discussion is about prostate cancer, but I mean, erectile dysfunction is an important part of men's health.
Exactly.
Yeah.
Wow, man. And I love that there's jokes about it. Yeah. I think when we make jokes about stuff, it kind of lightens the situation a little bit, right? Then you can be more open to it. I love that. So we want to get into this prostate cancer chat now. And I mean, this affects about, I think they're saying 1 in 15 or 23 men will get prostate cancer in their lifetime, right? And I think about, is it over 4,000 men die from prostate cancer annually? That's in South Africa, and I think it also extends to overseas. Maybe the number might be more if you go to other countries. But, just looking at those stats, we can see that it's something that's very prevalent in our communities. So what is prostate cancer? Actually, let's just start at the very basics of defining what it is.
Okay.
Yeah.
I must say I'm impressed with your homework. Your stats are quite impressive. Prostate cancer. Well, what is the prostate? Because remember, for you to have a cancer, it's in the prostate. So the prostate, essentially, it's an organ. I actually bought my gadgets. I like demonstrating.
We love it. You see, I've been saying, guys, you need to step the game up, man. Look what Dr. Morolo has got for us. Huh? Come on.
Yeah. So I like, because the thing is that as doctors, we've got the anatomy in our head. And when you start mentioning words, people get frozen a little bit. And so I like demonstrating when I talk so that we're on the same page. So the prostate. So the prostate, essentially, it's an organ. This is the bladder, first of all. And remember that to put the bladder into context, we've got the kidney, which is where the urine is made. And then there's a pipe on both sides, from each kidney that goes to the bladder, and then that takes urine from the kidney that makes the urine, and then takes it down to the bladder, and then the urine is then stored in the bladder until it's time for you to urinate. Now the prostate lies underneath the bladder, and then it's surrounded by the urethra, which is the pipe then that you use to urinate from the urine that's stored in the bladder. Then you urinate it through the the urethra. This is a male diagram, but obviously females have also got a urethra. So the prostate now is around the urethra. And so that's the prostate. The prostate is an organ that lies below the bladder, around the urethra, and then it's in front of the rectum. And then, So in terms of what the prostate does, the prostate basically, essentially, it plays an important role in fertilization. It produces calcium and other enzymes and so forth, and prostate-specific antigen. We'll speak about that when we talk about screening. And so prostate is a normal organ that has got an important function.
Sure.
Now, and it's made up of cells, at the cellular level. Now, when cells in the prostate then change their morphology and their DNA changes, then we call it mutate. So when the prostate cells mutate, eventually that mutation can result in the cancer then becoming the cell then becoming a cancerous cell, and then they increase the number of cancer cells, and then it becomes a full-on cancer in the prostate. So essentially, prostate cancer is when prostate cells mutate to become cancerous, and so that they don't perform the original function of the original cell. In other words, it doesn't now perform the function of the prostate cell, which was intended, because now it's changed. And then, in addition, it can then spread to surrounding organs, and then it can spread to other distant organs. And when it spreads, it then also prevents that organ that it spreads to perform its proper function. Like, for example, if it spreads to the bone then doesn't perform its proper function again.
Wow.
If it spreads to the lungs, it affects the functioning of the lungs. If it spreads to the liver, it affects so it's important. That's why it's an important organ, and to screen for it, we'll talk about that, because once it's in the prostate, it prevents the prostate from functioning normally.
Wow.
And then if it spreads to other organs, it prevents those organs from functioning normally. So, yeah.
Wow. And how does it spread? So you're talking about a spread, whether to the lungs or to bones or any of that. So does that spread, is that determined by where it starts off? Because, it's all in the prostate, like you say. So what makes it spread to different areas of the body? Is it maybe a weakness I have in my body? Maybe I had broken bones somewhere, and that's a little bit fragile, so it attacks that spot. How does that work?
So every organ has got a lymphatic drainage. So lymphatic drainage is where the body almost clears infections, clears dead cells and all of that. So every organ drains to that. So, and that lymphatic drainage also then is connected to the blood system. So when there's an organ and then it's becoming, like the cells are becoming mutated, and then it now drains to a lymphatic system, then it means that those cells will then now spread to the lymphatic system when the prostate cancer, progresses. And then once it's spread to the lymphatic system, with time, it will then also spread into the blood system. And then through the blood system, it then goes to other organs. Wow. Normally, the organs that it affects are the ones that have got a high blood, blood flow to that organ. For example, the lungs, and the liver as well. And so that's the reason why, that's how it spread. As it progresses, it goes to the lymphatic drainage, and subsequent to that into the blood system, and then it goes to those organs. So, so that's how it happens.
Anatomy is just fascinating.
Yeah, it is.
Yeah.
In fact, the human body in total, the creation of the human body is somewhat like unimaginably like genius.
Yeah.
Even genius doesn't even begin to describe
Exactly.
the kind of wisdom that it took to create this being that we're still trying to figure out. Yeah.
Praise the Lord.
Yeah, for sure.
Praise the Lord for that.
For sure.
Sure. So now, now we going into now, before we go into the screening, there are symptoms and causes to it, right? So what are some of the common symptoms that are there? And maybe even the uncommon ones, because I'll feel some stuff down here, and I'll feel like, it's just a pain that will go away. And, most guys will say, man, and I also internalize that, like, I'll go check whenever. But then at the end of it, it's like, maybe it's something underlying that my friend doesn't really know about, or he's never really shared his symptoms. So you're kind of like on that path of like, trying to do a dance, but no one is really trying to take the step forward. So what are some of the causes and some symptoms that you can also highlight that you've seen that are not so common?
Okay, so let's start with the causes. Prostate cancer, like many other cancers, is very difficult to see what the cause is. Like I say, based on what the risks are, and maybe let's start with that. People who are at risk of prostate cancer, it's according to age. So the older you are, the higher the risk is. And when we talk age, mostly the risk increases from the age of 50, and it significantly even more increases from the age of 70. So age is a risk factor. And then having prostate cancer in the family is also a risk factor. Not only prostate cancer, but breast cancer. And also black race is a risk factor for prostate cancer and for actually getting a more aggressive kind of prostate cancer. So those are the risk factors. And based on that, that's where most of the research is trying to understand what are the causes. And at the moment, it looks like it's aligned with genetic makeup. So there's a lot of studies that are actually trying to understand what is the different genetic makeup compared to, for example, Caucasians versus the blacks, or what about an African gene that is associated with prostate cancer. So there's a lot of research about that. So the cause has not been pinned down to what actually causes it. At the moment, we are just looking at the risk factors and trying to see what in that population is consistent, so we can see what is the cause. And then regarding age, as any cancer, any cell in the body, it can potentially mutate and change form and therefore potentially become cancer. But then the body is made such that when things changes in your DNA, you are able to repair that part of the DNA that has changed in every cell in the body. And so as you get older, that capability it decreases because your body is not as young and easy to correct things as it was in the past. And so that's the reason why age is also associated with many cancers and many acquired diseases, because the body is not able to correct itself as it used to be in the past. Combined with also environmental exposure, which I said also you're exposed to toxins in everything, what we eat, smoking, alcohol, and all of that. And so that's to answer the question about the causes. And I don't really like talking about symptoms when it comes to prostate cancer, because essentially you shouldn't be waiting for symptoms to actually present to a healthcare professional. This is where we then start talking about screening. So every male who is more than the age of 40, who's got risk factors, and we spoke about age, but we spoke about age being increasing at the age of 50, the risk of prostate cancer. But every male who is black, African, and who is got a family history of prostate cancer, your father, your uncle, your grandfather, somebody had prostate cancer, or your mom, your aunt, your grandmother had breast cancer. At the age of 40, whether or not you've got symptoms, you need to then present to a healthcare professional so that they can check whether you've got prostate cancer. We call that screening, meaning check before you actually have symptoms. If you don't have those risk factors, any of the risk factors, then you can go screening at the age of 45. So that's an important message, because I'm saying screening, meaning you are going to check even when you don't have symptoms. By the time you have symptoms, unfortunately, with prostate cancer and many other cancers, it's already spread to surrounding organs or distant organs. And by that stage, perhaps we can treat you, but the likelihood that we can cure you decreases if it's spread. And so we want to catch it while the prostate cancer is still localized in the prostate, so that we can potentially cure you of prostate cancer. So that's why I don't like talking about symptoms, because we don't want to wait for you to get symptoms. We rather want you to screen before you have symptoms, because then we've got a potential for curing you from prostate cancer.
Wow. So fascinating. I'm now trying to wrap my head around all of it. So there's ways that we can then check ourselves as well, right? So just like testicular cancer, I know we were speaking with Torsten, who's going to be one of the episodes that we're putting out on testicular cancer, where he speaks about, there's a way for you to feel for lumps in your balls, if you call them that. There's a way for you to check, before you can go see someone. So when it comes to screening, testing, or whether it is self-examination for prostate, how does that process work?
Okay. So prostate cancer screening is composed of two parts, and both of them have to be done for you to say that you have been screened.
Okay.
The first part is the examination that your doctor does. It's called a digital rectal examination. And maybe I can go back to my little gadget and show you that. Remember I said that the prostate lies in front of the rectum, and the rectum, there's the anus, which leads to the rectum, and we use the rectum to access the prostate. If you can see that, by putting your finger through the anus into the rectum, we will be able to palpate the prostate, the piece of the prostate that is now close to the rectum, and see whether we can feel nodules. That's called a digital rectal examination. Okay. But as you can see in this diagram here, the prostate is a 3D organ. It's an organ, and you may not be able to feel all parts of the prostate just by a rectal examination.
Okay.
So combined with the rectal examination, you also have to do a prostate-specific antigen. We call the PSA blood test, and that test PSA is also produced by the prostate. And so when PSA is elevated, it's also something that is a flag, because we need to see, is it elevated because it's prostate cancer? Because there are other reasons why PSA could be elevated. But when it is elevated, we want to chase that and see. We need to exclude prostate cancer. So those are the two screening tools: the rectal examination, digital rectal examination, and the blood PSA prostate-specific antigen test.
Wow.
And if both of those are negative, bearing in mind that with the PSA test, you need two positive tests. So if you only have one, you need to check, you need to do two. So we need two positive tests for us to say, yes, it's positive.
Wow.
And if both of those are negative, then you're fine. But if either you've got two positive PSA tests or a rectal examination that is abnormal, then we need to investigate further. Wow. So any of the two tells us that we need to investigate further. We haven't even started diagnosing, we just screen. Remember, screening just says, just trying to, in a whole population, who are the people that we must chase for this condition. So that's the screening tool. So those two tests, those two investigations.
Wow. And that sounds very invasive. Now we're talking about now putting a finger in the anus and that. Now as a guy who's like never, had anything go up there, then it's like, now I have to go do this. It sounds like so frightening, right? Could you say that's one of the reasons that men don't actually come for those tests?
Perhaps, but in all fairness and honesty, it really isn't that bad. Honestly, I know you don't believe me, but trust me, it isn't that bad. Plus, I'm a female, so I've got thinner. That's the one plus of going to a female urologist, isn't it? You get a thinner finger coming in. Yeah. Exactly. So, it's not that bad, because I've had a lot of patients who actually I do the rectal examination and they're all anxious prior to the examination. And after that, they're like, okay, was that all? Are you done? And I'm like, yeah, I'm done. I've done my examination. Wow. So it's really not that bad from the feedback. And it really, really isn't that bad. The anus is not something that's completely closed that you're not going to force it open. No, it's an organ that, remember, like if to make it crude, a finger of any urologist, male or female, is a lot thinner than what naturally comes out of the air. Like, let's be real here.
Let's be real.
Like number two, the stool that you pass there. Some of them
can be intense,
bulky, if you want to put it nicely, and a finger's nowhere near that. I think that's a good way to explain it. A finger is possibly half or even less the job that happens daily or every other day, however many times you go to do number two. So, if you can go and do number two every day, you certainly can see a urologist once a year to have a smaller finger passing through the anus. And also check your health. Your health is that important. Your health is your wealth. How on earth can you contribute to the country? We've got a beautiful country, and we need all hands on deck to fix and continue the great work that's happening in this country. We need all hands on deck. And if you're not healthy, your hand is not on deck. So you need to check your health.
Man. So you're talking about this now, and a lot of it is a lack of information, I think, because then I'm going to hear about it. Like now you just heard a finger up the ass and you're like, no, not going there. But there is information that you can read and familiarize yourself with the process, and it kind of lands easier for you. So what do you think is the thing that we need to do to encourage more men to get out there and get help? I know you alluded to it in quite a bit of what you've been saying, but in terms of the proactivity, instead of being reactive, like you're saying, we're waiting until it's like really bad for us, and like only then, and you go to a urologist, you skip your doctor that you see all the time, who can then also give you information. I think Dr. Ijani alluded to that some guys just rock up here and think, no, I need a specialist. It's like, oh, hey, you can actually just go to your GP and get checked, So how can we get guys to come out more and stop like the stigma? I don't like calling it a stigma because, from the work I do, I've kind of learned that men do actually get checked out. They do talk. But to the ones that, especially in like rural areas, where they don't have this kind of access to, it's like a small little clinic that's, limited in resources. It's probably packed away within a month and they have to go restock and they'll be back after I don't know how many months again. So what about people like that, and how can we then make information accessible to them?
I think to answer that question, I'll go back to your stats, just to make it come home. That the lifetime risk of prostate cancer in all races is 1 in 15. In other words, every 1 in 15 men have got a lifetime risk of getting prostate cancer. That's the first thing. Now, if we make it more specific, if you're an African male, black African male, your lifetime risk is 1 in 4, like you mentioned earlier. So every 1 in 4 African black males has got a lifetime risk of getting prostate cancer. If you're Caucasian, like just to juxtapose that, you've got a 1 in 8 lifetime risk of getting prostate cancer. So if you look at those stats, there's every reason for you to actually go and get screening for prostate cancer. Having mentioned those stats, then you would have to see a patient who has got prostate cancer that has spread, which we call metastasized, to actually realize that this is not actually, it doesn't need to get to this level before you overcome your fear or whatever it is that's preventing you from actually going to the healthcare professional. Because we have a lot of males that actually present with disease that spread to the bone, that are not paralyzed, for example. So when it spreads to the bone, you can actually get paralyzed and wheelchair bound, because now the cancer is now spread to the bone and normally starts in the lumbar, sacral and lumbar area, pelvic area. And then you get paralyzed. And like I mentioned, now when you're paralyzed, you certainly are not as functional as you were before. You certainly can't contribute as you should have if you are fully functional. And incidentally, if we had caught it more, earlier, we could have potentially cured you of the cancer and bypass this possibility of spreading it to the bone. So both based on those two things, that's how I think those things should motivate you. First of all, the stats say that men should go and screen for prostate cancer, and screening will prevent, let me go on the positive side. Screening will allow us to pick up the cancer while we can still cure it, hopefully, because you don't have symptoms. And then if you do have symptoms, it's still worth your while coming, so that at that stage, if it's prostate cancer, we can already treat it before it progresses further. Because remember, it's an ongoing journey. The cancer will continue doing its job until you stop it in its tracks. Otherwise, if it's still asymptomatic and it's there and you don't go do the testing, it will continue. Then it will spread to the local organs. If you don't test, it will then continue spreading. Maybe you get symptoms, and then if you don't take those symptoms seriously, it will then progress until ultimately you will die from the cancer, So if that's not motivation, then I'm not sure, because we all want to stay healthy. And we all want to live as long as possible with a good quality of life. You just don't want to be alive and have pains and aches. And you want to be healthy, you want to laugh, you want to enjoy your life with your children, family, hopefully one day grandchildren and so forth. And so the only way you can confirm that is confirm your health and maintain your health.
Man, come on, guys. I think a lot of us often take care of our cars, man. We take care of everything. I went to earlier this year for my birthday. My lady treated me to a nice spa day. So I was getting my nails buffed and all of this. And I felt so princely while I was sitting there. And the ladies who were doing it were saying to me, but you guys, you're so silly. if I go to your house, I'm sure your DSTV is paid up, your internet is sorted, your booze are there, you've got your whiskeys and whatever in the house, whatever it is you enjoy. But if I ask you about like, when do you take care of yourself? It's like very little time or very little opportunity for us, or we don't offer ourselves that opportunity to go out there and take care of ourselves, And I know I'm using a very random example of,
That's a brilliant example. You know why?
Yeah.
Because I have just got an idea that I'm going to encourage the females to bring their males for a prostate massage. They must come for their annual prostate massage instead of going to the massage parlor. Well, part of it, they must go to the massage parlor and get their, shoulders and what's massaged, but they must get their prostate massage, because the rectal examination is essentially us palpating and massaging the prostate, and in the meantime, we're also assessing the prostate. So, women out there, bring your men for a prostate massage to our rooms.
Okay, now I gotta ask you that. Now I've never even heard of a prostate massage. So what do I just book in and hey, I need a massage, or is it?
No, it's something that
how do we do it?
I just came up with it now because it's a rectal examination.
Sure.
But I'm just playing on the whole massage story you were just telling me, that if massage is such an enticing thing to do, then come for a prostate massage.
Well, that's why I'm like, hey, now I want to do it.
Yeah. In the medical sense, in the urological sense, we do prostate massages when for example, when a patient has got prostatitis, and we want to test if there's, organisms in the prostate, and we want to massage the prostate so that we can stimulate the secretion of the prostatic fluid, and then we test that particular fluid and see whether is there infection elevated, like, lymphocytes, which is blood cells, a particular type of cells in the blood, and also if there's organisms. And by massaging it, we are stimulating the prostate to release the fluid so that we can test it. So in the medical sense, a prostate massage is for investigating the prostatic fluid. But in the context that I'm talking about, I'm just saying that if coming to the doctor is such a bad thing and yet you enjoy going for your massages, there's a prostate massage that you can come for at your urologist or GP, depending on who you go for your prostate massage.
Hey guys, so there we go, man. You can start off the year, just, tell the lady that, hey, there is such a thing called a prostate massage. How's about we go try it out?
Or the lady can sneak in a prostate massage in your spa massage and say, listen, we're going to start with the other massage, and then after that we go for the massage, the proper massage, like at the spa and whatever.
Then
so we'll start with the prostate
massage,
and then after that, and then you've killed 2 massages in one day,
Right.
And so at least maybe you'll even forget the prostate rectal examination that is so-called painful, once you've had the full-on, body massage and facials and so forth. So I think we should incorporate it into your massage treatment.
I think so. I agree with that, man. I think Gabo also agrees with that. So I think we've been largely talking about symptoms and what is it and that. So what are the solutions now? So someone has prostate cancer now. So the treatment, how does that work, and how do we then? We can get rid of it, right? So how does that whole process work?
Okay, great. I like your progression. So initially you don't have symptoms, and then you go for your rectal examination as part of your massage treatment.
Yes.
And then we're screening you, and then at some stage perhaps you end up having a positive screen where either your rectal examination or your blood tests are positive, and then we need to take a biopsy. A biopsy is then done, and then that specimen of your prostate is taken to the lab, and it comes back and it says, yes, there's prostate cancer. And depending on whether there's indications for us to see how far it's spread, we then do certain investigations to see that, yes, you've got prostate cancer, but at what stage is it? So we do various tests, bone scan, PET scans, PSMA PET scans, CT scans, and so forth, to see has it spread to other organs. And then at that stage, we can then stage it and say, yes, it's prostate cancer and it's localized to the prostate, or it's prostate cancer, but it's locally advanced. It's either maybe spread to the surrounding structures or organs, or it spreads to the regional lymph drainage. We spoke about the lymph drainage earlier on. Or it's prostate cancer, but now it's spread to other organs, the bones, visceral organs, for example, the lungs and the liver, like I've mentioned, or it's even before that, it can also spread to distant lymph nodes. So we've got the regional, which are the ones that drain for the prostate. But then if it goes to the lymph nodes that are far away, for example, the ones around the aorta, then, well, I'm not talking medical terms, and unfortunately I don't have a face, but it's like everybody knows the aorta, isn't it? It's like it is the biggest artery in the body. So, and it's far from the prostate. So if there's signs of prostate cancer in lymph nodes in that area, it means that it's already, we call it as already distant metastasis. So then we can stage you. If it's localized disease, we can potentially cure you from prostate cancer. And there's various options that can be done. We can take the prostate out. There's also diagrams that I've got here in this little booklet that I can show you. So we can take the prostate out, which we call a radical prostatectomy. And that one, most people actually are intimidated by that, because most times when you have a radical prostatectomy, the risk of that is that you can actually, the complications of that, you may end up not having proper erectile functioning, and also you may end up being incontinent, meaning you can't control your urine for a period of time. Some people, most people, after a year or so, it actually resolves, your continence of urine resolves. So a prostatectomy is essentially where we remove the prostate. And when I mention about the complications of that, so we have the prostate here, and behind here there's nerves. So if we take, this is the bladder, and this is the prostate around underneath the bladder. So behind the prostate there's these nerves. So if we do a nerve sparing, we will actually cut the prostate around there and leave those nerves. Those nerves have an important functioning for erections, and so when we spare those nerves, we actually can decrease the risk of you having erectile dysfunction. It doesn't say 100% you won't have erectile dysfunction or your erectile dysfunction won't deteriorate, but it's the little that we can do to try and decrease the risk. And so that's what we can do. Other options for local, prostate cancer is one of those diseases, lots of options, for every stage of the disease. But I'll just focus on the more common ones. So radical prostatectomy is one of them. And then if it's localized, you can also have radiation that's specifically given to the prostate. So they put, rods inside, they put instruments and they put radiation, how can I put it? Like pots inside the prostate that will emit radiation and actually, cure you from the cancer. And then when it's locally advanced, one of the options you have is radiation that actually comes from outside. So this is a diagram of that, where you have the radiation that's coming there. It's like X-rays, and then it just, it radiates the prostate. But with the radiation coming from outside, as opposed to the one I've just showed you earlier, it may then, you end up also radiating the bladder, which is close by, and the rectum, which is close by. And as a result, you have symptoms around that. You may actually have blood in your urine, for example, blood in your stool, for example. So those are some of the things. And then when it's now spread to the outside, when it's metastasized, then that's when we then have to remove the testes, for example, because the association with the testes now is that the testes actually produces testosterone. So the testes is this part over here. It produces testosterone, and testosterone plays a crucial part in the progression of prostate cancer. So when we decrease the production of testosterone, or we remove the production of testosterone from the testes, we are then starving the prostate cancer from testosterone, and as a result, decreasing the rate of progression. By the time it's metastasized, we can't cure you. All we can do is decrease the progression of prostate cancer. So that's the sum total. And I can tell you that even when patients have got metastatic disease, when it's spread, and we then put it to them, the males, that we need to remove your testes, it's a big issue. Like men don't want their testes removed.
It's like, I don't feel like I'm a man anymore with no testes.
It's just like that. Like they'd be like, you know what, doctor, I hear you, but I would rather die of this cancer than have my testes removed. Incidentally, there's a verse in the Bible that also talks to this, that you may not reach the what is it, the kingdom of God, if you've been emasculated, and I may be paraphrasing it, but literally there is a verse in the Bible that speaks to that. Yeah. The congregation of God, or something to that effect. So that's how big removing your testes is, that it's even it's like this biblical association or reference to it. So men are not comfortable at all with removing their testes. So, and unfortunately, if we want to decrease the progression of prostate cancer, at that stage, we've got very few options, and androgen deprivation therapy, which is when we decrease the testosterone level in your body, is one of the biggest tools we have. And you can either do it surgically, which is removing the testes, both testes, or you can do it medically, where we give you an injection, and that injection suppresses the testes from producing testosterone. But either of them have the same result in terms of decreasing the testosterone. But it's just that some people will just feel like, I want my testes in place, even if you just give me an injection to decrease testosterone level. But as long as my testes are there, other people feel like, you know what, I don't want anybody tampering with my testosterone level, because obviously when your testosterone level is low, erections are not the same as before, quite obviously. Your whole testosterone plays a crucial role in male, in a lot of things in the male. For example, your mood, your cardiovascular function is also related to testosterone as well. Your bone, bone mass, so bone density, I should say. And so all of those, when you decrease your testosterone level, a lot more than just the impact on the prostate cancer is felt. So the rest of the body also then suffers from a low testosterone level.
Man, this is so informative, I think we're dropping so many facts, right? And when it comes to information, especially, and I've been alluding to this in like small little patches, but what are some of the biggest or some of the myths or lies that you've heard about prostate? Because, I like saying that there's a lot of misinformation, or it might be presented well, right? But because of how it's presented to you, you might be like, this seems like, this whole mountainous thing that I have to do, I'd rather not do it. And it stops people from getting help or seeking whatever assistance they can get, or even speaking about it. So what are some of those lies that you kind of hear and you're like, no, but that's not true. I've worked with this stuff, and I know that I haven't seen that or heard that in my studies or in my interactions that I've had.
It's a very difficult question, because unfortunately, what you hear about prostate cancer and removing the testes is the truth.
Sure.
It does take away your manhood.
Sure.
Part of the treatment does affect that. So sometimes when I discuss with the patients and they tell me that I hear that now when you remove the testes, I won't be like my manhood my erections will not be that strong anymore and all of that. And I then have to get to the level that, listen, this is now an issue of life and an issue of quality of life. At this point, if we don't remove the testes, it's actually threatening your survivorship. You may not survive as long as you could potentially survive if we decrease the testosterone level. Sure. Yes, it will impact on your quality of life, because perhaps your erectile functioning or sexual functioning won't be the same. But now you have to get to the level of, life, survivorship, and perhaps quality of life in the area of sexual functioning, because quality of life is not only about your sexual functioning, it's a lot more than that. But suddenly, you actually realize that sexual functioning is like a big deal to men, like huge deal.
Yeah, that's like defines some men,
I know, it's huge, because you find men coming with their partners and they're like, no, removing my testes, I won't be able to function in the bedroom. And the wife is like, what do you mean? We haven't been meeting for the past 2 years. And so what's the big deal? Or what do you mean? I would rather you be alive than us compromising your life for sexual things.
Exactly.
So it's a big deal for males. So yeah, unfortunately, the true fact is the worst case scenario is the truth with regards to prostate cancer. Sexual functioning may be impacted by our treatment, and you may become incontinent for a while. But like I say, there does come a time in life where you are now faced with the difficult decision to make about survivorship and a component of your quality of life. And it does come to, and that's why you should screen so that you may not necessarily reach the stage where we compromise too much. You know, we may do those nerve-sparing operations where you can maintain your sexual functioning. And so the myths out there, I don't know any of them, but the worst-case scenario is the truth. It's not a myth in prostate cancer where you lose your sexual functioning in regards to erectile functioning.
Guys, so that's why we need to get checked, man. Be proactive. Please take care of yourself. Get your partner to help you out, man, if you're feeling a bit too shy about it, right? But I think, Dr. Morolo, one of the things that, you work at the urology hospital, but I know you've got your own practice as well. So we want to get a bit into that as well in terms of how people can reach you, how they can get in touch. Your practice is called Africa Urology. So how did that come about, and why urology? Instead of any other medical field?
Why urology instead of any other field? I'll start with that one. I was, I did my medical degree at Medunsa, now Sefako Mogato University. And after that, I did occupational health. And then subsequent to that, I worked in the corporate doing a lot of occupational health, and then I decided that, I want to start my own occupational health practice. And the spot that I used to open my occupational health practice was a GP. So I bought a GP practice. And so by default, I inherited that doctor's patients. Even though I was opening an occupational health practice, I inherited his GP practice patients because he sold his practice to me. And while I was continuing with my occupational health practice, I then had to, ad hoc, also see his patients, and a lot of them were urology patients. And then I just felt like I wasn't doing them justice because urology doesn't actually feature a lot in our training in medicine. So I went to Steve Biko. In fact, I called Steve Biko so that I can actually perhaps attend some of their ward rounds. That's what I was thinking. And somehow, there's very little that I remember about this. I always tell people that I need to come up with a clever answer for this because it sounds like I just got sucked into urology, and that's what it feels like because I really don't remember what happened between me just making the call to come and do a few ward rounds to me becoming a registrar and an MO at the urology department because I made the call and somehow there happened to be a post and somehow I went for that post and I got the post. I went for the interview, I should say. I got the post and I ended up selling my occupational health practice and starting specializing in urology. And like I say, now I'm a urologist. And so it just happened very fast, I must be honest. Africa Urology was started after I completed, where I wanted to focus on Africa in a true sense. Although it's private, my passion is actually in the public because the majority of patients are in the public. And that's where I actually see myself having an impact. I see myself having an impact by bringing in the resources of both the public and the private. And if you talk about the resources in the public, it's the kind of wealth of healthcare professionals in the public sector. We've got exceptional doctors, surgeons, medical physicians in the public sector with a lot of research happening and a lot of research outcomes that have got clinical benefit for our patients. And all that wealth of knowledge is in the public sector with the doctors and so forth. Then we've got the resources in the private sector, in the sense of access to high-tech equipment. Although it's there in the private, in the public, it's just that in the public, one takes a lot longer to access the services as opposed to the private.
Exactly.
And then also there's financial resources in the private sector. And so my role, which is what I'm driving at the moment, is somehow merging the resources of the private and the public for a mutually beneficial outcome. Yes. I call myself Dr. Synergy, because synergy means our contribution together is more than the sum of our individual contribution. And that's who I see myself being, because I'm able to bring a lot of parties or strategic partners together with the same goal, and the outcome of that will be better than the sum of the individual contributions. So certainly where I'm going now in my path, I'm going towards merging the private and the public healthcare sector, so that we can have a mutually beneficial solution. And a lot of people have that, drive and that wish and that intention to do that. And I appeal to anybody out there who's also got that mission. And I'm not necessarily talking about NHI. I don't want to call it anything, because I know that people get very, especially in the health sector and in private in general, people get very uncomfortable about the NHI. But what I'm talking about now is actually the public sector. Like I mentioned, there's a lot of resources there. So when the only problem with the public sector is that the supply is not able to meet the demand. So that excess demand there that the supply is not able to actually meet, that must be incorporated into the private. And we must find a solution that's mutually beneficial, that caters only for that component that the public is not able to deal with. And that's the tweaking of a solution that I want to be a part of. And I appeal to anybody who wants to be a part of that to reach out to me. Africa Urology at the moment is based at the Urology Hospital in Hatfield, and also based at Cure Day Hospital in Midstream. And contact details, telephone is 010-500-3339. And then we're on most social media. We're on Facebook, we're on Instagram, Africa Urology. And yes, there's multiple components of Africa Urology. And another component is about giving back. And this is the component that I talk about. It's a big component of who I am, because I certainly don't believe that I'll be contributing if I only focus on the private sector. I am committed to improving the service delivery in the public sector.
Wow. Man, that's so powerful, man. Dr. Morolo, I wish you all the best in all the work that you're doing. I think you've enlightened me quite a lot. I've done my research and I did a lot of reading and studying. But like I say, when you read something and you have to kind of make sense of it by yourself, it's kind of like, this is a lot, man. But you spoke to it in such a entertaining way as well, and very much, obviously you use some medical terms that some of us might need to go look it up online, or maybe open up some textbooks and check, but you brought very much light to the conversation. And I think for any man who's listening, to the guys in our audience, one of the things that we did with Dr. Ijan was try to not water down the language of the medical world, but give you something that you can also kind of find relatable. So I really appreciate that you came and you spoke around something that we deal with as men quite a lot. And you can see, guys, you're in a relationship, you've got a woman, you've got a girlfriend, some of us are gay, and that's okay too. But for the most part, it shows you that you don't have to put yourself in boxes and put people in boxes and say that, hey, because of the sex you are, then you are not able to assist me. So I really appreciate your time. I really appreciate your knowledge and the work that you're doing with the Urology Hospital plus Africa Urology. I wish you all the best. And I would love to, have you as part of our sort of umbrella as Manned Up for guys who want to get checked and tested.
You're most welcome. It's my pleasure. I love sharing knowledge. I love being of help in the area of my expertise. And more importantly, I really hope that the knowledge it doesn't end with being knowledge. It needs to be activated. You can knowledge, Mandela says, the saying of Mandela says knowledge is power, but I want to extend that and saying using the knowledge is power, because it's no good having knowledge in your brain and it doesn't impact on your health, for example. So use that knowledge to actually improve your health. And another thing I'd like to also add in closing is that you mentioned that I use some information that I obviously am not aware of, because it's like normal wording to me and terminology to me. But if there's any information, extra information, follow-up questions, additional understanding what we spoke about further, please feel free to reach out to me. I will certainly respond in any way, whether it's an email or use any of my social media. I will certainly respond to any of those, because as I say, I am committed to improving the health in the area of my expertise, which happens to be urology. And so if there's anything extra I can do to do that, I'm more than happy.
Man, I really appreciate that, man. Guys, put that knowledge into practice, man. Make sure you get checked. Make sure you get tested. Don't forget about the prostate massage, all right? Ladies, please. But man, it's been another installment of Man Up Conversations. I am Kaugelo Habiani, the Urology Hospital. We at it again. And thank you to Dr. Morolo once again. Peace and love, guys.